Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We're going to convene the Mendocino County Board of Supervisors into a special session. Can you conduct the roll call?
Yes, I can. Supervisor McGordy?
Here.
Supervisor Mulherin?
Here.
Supervisor Haschak? Supervisor Jurdy?
Here.
Supervisor Williams?
Here.
Thank you.
Okay. I'd like to go to the Pledge of Allegiance then. Okay. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. And next on our agenda is public expression for members of the public who wish to comment on, we have closed session item and we also have non-agenda items. So do we have any people who would like to comment? And before we do actually call on them, I want to announce that I'd like to appoint an ad hoc committee on looking at the CAO ordinance here in Mendocino County and elsewhere. And I'd like to appoint Supervisor Mulhern and myself to be on that ad hoc committee. Any concerns or objections?
No, thank you both.
Okay, all right, thanks. So with that, do we have any public comment?
We do. We have one public comment. First in the line is Dr. Corin. Dr. Corin, you can begin when you're ready.
Okay. Can you hear me?
We can.
Okay. Thank you, Chair Jurdy, Supervisors, and CEO Angelo. This is a general COVID informational update for you and members of the community who may be listening. I believe that our COVID epidemic may be described as a calm before a storm. In the month since I last reported, we've seen in California and the United States, cases and hospitalizations begin to increase, though Mendocino has had a slight decrease, yet persistently high transmission. Worldwide, a new and very different variant of concern has emerged named Omicron. It was discovered first in South Africa in early November with rising prevalence in the context of their Delta surge. It has been found in about 20 other countries on all continents, including Canada and North America. Travel restrictions and lockdowns have been implemented around the world, including some travel restriction in the United States. This variant has the public health community very concerned because it has over 70 mutations already found, with 30 mutations on the spike protein areas that are associated with transmission and are the target of our immunizations and some testing. It'll take weeks to determine the characteristics of this variant, such as virulence, predilection for certain populations such as children, potential for vaccine breakthrough or escape, or resistance to treatments such as our monoclonal antibodies and new antivirals. So at this time, public health organizations are working to rapidly investigate the biology in the labs and epidemiology in our communities. Current hypotheses range from mild, rapidly spreading virus that could actually improve natural immunity versus a virulent, highly transmissible variant that could defeat our current testing, vaccines, and treatments. It's important to avoid generalizations and fear or panic based on anecdotes and to await more evidence. But it will take weeks to know more about these characteristics. Less than 200 cases of this variant have been identified in the world so far. Vaccine manufacturers have said new vaccines could be available in 3 months if needed. Then we would have to deploy them rapidly. In the meantime, we're not helpless. Increased testing is essential to find new variant if it arrives, investigate and trace the contacts, and avoid outbreaks. Vaccination is still the safest and most effective way to minimize cases and deaths. Vaccines don't only stimulate the production of antibodies, but also immune T cells and B cells, cells that are recruited with any new invading organism and could be expected to have activity against a new variant. Also extremely important are our non-pharmacologic interventions, such as masks, hand washing, ventilation, distancing between people, and advice to stay home if sick. These will be key to saving lives and maintaining our health facilities for the treatment of COVID and all other illnesses that they care for. Thank you.
That concludes public comment.
Okay, thank you. So we have one item on our agenda today, and that's a closed session item. It's pursuant to Government Code dealing with legal counsel, litigation one case, CPUC proceeding R2009-001. Just looking at County Council, is there anything else we need to announce before going to closed session?
No, that's sufficient.
Okay, well, we'll go into closed session now.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County.
The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic, we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
ये bet में आया.
我们能够做到.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste. આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
So board gave direction to staff in the proceedings with the CPC. Allegheny County Council, is there anything else we need to announce?
Yes, Mr. Chair, just that the board authorized the seeking of intervening to seek party status in the captioned proceeding, and the vote was unanimous.
Okay, great, thanks. Okay, well, with that, we're adjourned.